please join me in welcoming Vinod Khosla to the stage. Vinod, we're going to put you here.
Great.
That way you can kind of face everyone out there. That's the most important group. And Jordan and I are going to, interrogate you a bit. For those of you who don't know, Vinod is a legend in the world that I inhabited for the last 35 years. Vinod started a company called Daisy, if I recall. Yes, Daisy. Was a founding CEO of Sun Microsystems, and then spent almost 30 years at Kleiner. 20 years at Kleiner. And then started his own venture fund, which has become one of the most successful and largest venture funds in the Valley and in the world, frankly. Lots of investments in the spaces that we have been talking about. And as befits someone in his position, he wrote I think it was 75-page white paper on the impact of AI on everything, outlining a utopian version and a dystopian version.
It was only 25 pages, but
yeah, I read it triple spaced, and it had a lot of it argued that we are going to make the world better for the positive benefits of AI, and in fact, I counted 30 to 35% of the positive benefits that you wrote about were directly related to healthcare. And so there was a lot in there about everything we've been talking about, and we were very pleased. You had registered for the conference already, but after that paper came out, I'm like, let's call up Vinod and see if he wants to actually up his game and get up here and talk to us about this. So let's start with that. Can you summarize your thinking?
Has everybody read the article? We sent it out in the newsletter. Put your hand up if you've read this article. If you haven't, I strongly recommend you do. It's a very well-written piece.
Yeah. So let's start with this. Summarize for those of you who haven't, what your thoughts are about how AI is going to impact the healthcare ecosystem.
Well, let me put things a little bit in perspective. Most of you probably didn't know what GPT-2 did, but most of you know what GPT-4 and ChatGPT did. In that 2-year gap, there was about a 10,000-fold improvement in performance. We will see that same 10,000-fold improvement in performance of AI systems over the next 2 years.
2 years?
Yeah. So this massive exponential increase in capability is going to happen. What impact does it have? And most people have a hard time grokking the amount of change. There's a famous paper. How many people have heard of a paper called Situational Awareness? A few people. I'd recommend others see it, because it'll massively change what we believe will happen over the next 5 years, 10 years. In that context, one of those things will be almost all expertise will be free. And that means a physician will be able to, an oncologist will be able to do about as much as a farm worker can when it comes to the practice of medicine. Think about that.
Wait,
because the farm worker gets upgraded by the AI to practice at the level of a fancy oncologist.
Okay.
Think of all expertise in the world free, which means all expertise in medicine will be near free. It doesn't matter if you're talking about a cardiac MRI technician, an oncologist, a primary care doctor, a therapist, a gastroenterologist. All of that becomes near free. And that has huge implications for healthcare. I actually think the joining point of all this will be primary care. And we have great primary care. We'll avoid a lot of downstream costs. And chronic disease management. And it doesn't mean coaching. It means everything you do in chronic disease management, including drug titration, all that, will be just part of your primary care service, including all nutrition. We heard about eating, all supplements, whatever questions you want to ask. You know, do you want to take L-carnitine? What's in it? Yeah. the range of human knowledge will be in an AI. And so that has profound implications if we let it happen.
When you say free, just want to be clear on what that means.
The cost of computing,
The cost of computing will be free.
I say near free because it's the cost of computing.
And when you say all expertise, does that mean venture capital too?
Probably.
Free? Will that be free also? Okay.
And for those who want to ask me the next question, what will humans do? I address it extensively in my long paper.
Maybe you could tell us.
You know, most human jobs today aren't really jobs. If you look at the majority of jobs, working as a farm worker in the field, in 100-degree heat, bent over, picking lettuce or something for 30 years, or mounting a tire on a car on a GM assembly line 8 hours a day for 30 or 40 years. That's servitude in my view, not jobs. And I think we will have enough abundance to afford people minimum standards of living so they can actually do what they want to do. So if you want to be an artist, you will be an artist without having to worry about can you support your family, or a skateboarder, or and I address the basic human needs, which won't change, like the need for status, the need for competition, the need for et cetera, et cetera. Basic human characteristics won't change because our brain isn't evolving as rapidly as technology is.
And what's the dystopian version?
Well, so, people say sentient AI will take over the world. People say we'll lose all creativity. Will be controlled by an AI. There are many dystopian scenarios that you've all heard and read about, and I address them fairly extensively. The simple answer, most of those will be societal choices. Society chooses to allow or disallow certain behaviors in an AI. And those will be choices we make, and different societies will make different choices, I think. And these technologies will be adapted at different rates in different countries.
I want to get to that because one of the things I found refreshing in your piece, which I found distressing in others that you might sort of group as Silicon Valley leadership writing long papers about AI. There have been a lot of them in the last year. I found yours refreshing in that you acknowledged that there needs to be policy and that you acknowledge that governance is really important. Another very well-known VC, who I'm sure you know, Mark Andreessen, wrote a techno-utopian manifesto about 9 months ago that essentially said that we should basically pay fealty to the overlords of technology and get out of their way, and government needs to go away, and these problematic ethical commissions need to go away, and just let us being the royal us of the tech elite, we'll figure it out for you. I found that to be disturbing.
I found it disturbing too.
Yeah.
And I modified his techno-optimism as techno-optimism with care and caring. Care being safety, AI safety, and caring being including others who are excluded.
Right.
And we, for the first time in humanity, will have the abundance to share adequately.
Yeah.
So to have dramatically higher standards of living. You can do a simple calculation. If we can get GDP growth to go from 2% on average over the next 50 years to 5%, you have way more buying capacity. The measures of economic wellness, I think, will be all distorted, and I covered that too. Mm-hmm. GDP won't be GDP when, all medicals, primary care costs you $1 a year or $1 a month or whatever you chose to impose. So modulo bad measurement of GDP, we will have much more production of goods and services that people can consume, so everybody can have a rich lifestyle, rich in education, rich in entertainment, rich in housing, rich in transportation.
But in order for that to happen, we need a common, agreed upon distributive force that we have called previously government. And that government...
This is why policy is important.
Right.
You know, we forget capitalism isn't an inherent thing. Capitalism is by permission of democracy.
Right.
Voters can vote out policies that they don't like, whether it's immigration or something else, or women's rights, or and so I do believe democracy is a great system to gradually change policy.
So we should probably keep that.
And policy is going to be absolutely critical.
Yeah.
Yes. So we should probably keep that, not give in to President Xi.
Yes, thank you. There was a lot of mention of China in your piece.
I'm a China hawk.
I want to bring it back to doctors and ask you this, because there are about 40 or so in the room. What is the role of a doctor? You said 2 years, a 10,000-fold increase in the power and capacity of the AI. Capabilities. So I think a lot of these doctors in the room are going to be practicing in 2 or 3 years. Are they out of a job? What are they going to be doing differently? And how do we scale doctoring?
I think Jim Madeira is here. He told me after COVID, 25% of all doctors decided they wanted to retire. Jim can validate that in one of our many conversations. Yep, he's sitting right there. Here's the thing. I define in detail in this paper what the next 5 to 10 years looks like. And for the next 5 to 10 years, for every expert, you should think about they can hire near free 5 interns, so fresh MDs out of a medical school that work under their supervision. And I think this is a pretty good model to think of AI the next 5 years, maybe 10 years. And if they can do a lot more, expand their bandwidth. For example, in this country, we have 1/3 to 1/4 the number of primary care interactions per patient than we do in Australia. Could we multiply the number of interactions with the patient 10x? Easily. In fact, I often talk about it's pretty easy to manage 100 touch points with a patient every 100 days. And you can do chronic disease management, behavior change, lots of other things that we've been wanting to do quite easily with this expansion in capacity. If you imagine every physician having 5 interns, and they get to supervise the work, and in exchange for signing off, they get paid like they would if they'd done that session or interaction themselves. By the way, I think billing codes are the single biggest detriment to the adoption of these technologies.
Interesting. I just want to clarify, those 5 interns that were hired, are they people?
No, they are AIs.
They are
AI interns.
And
every software engineer...
Who are they paying? I'm just really curious about the business model. Are they paying for those interns? And is there a new AI company that is selling those interns to the doctor?
Yeah. And the doctor's signing off, and they get to bill the system for taking on the other question I get asked, legal liability. They're practicing under their license, supervising these interns with hopefully a much lower error rate than if they had hired 5 humans.
So are you going to, there's about 10 private medical doctors in the room here. Are you going to hire the next 10 are going to be AI agents?
No. I do believe that there is, to your point, Vinod, there is a use case for a doctor to, rather than sift through a bunch of information, have it kind of collate, organize, and bring a bunch of pattern recognition to my desk so I can say, okay, like this is the differential diagnosis, this is the potential thing, now what do we do? Or do we do anything?
Well,
and so I do believe that AI will give us superpowers to make our lives easier. It's not there yet. I mean, we've been tinkering around with a lot of stuff at our practice, and it's still like trying to plug one thing into the other thing, like nothing really works together. So there's this interoperability question. Everybody's got their proprietary this, and it's not really open yet. I hope it gets there, but I do think there's an opportunity for all doctors to use these tools, like Open Evidence, which is a new tool. If any of you guys haven't used it, I recommend you download the app and use it. It basically is a small language model, but it looks at all the literature of anything that's ever been published, so it doesn't search the whole internet, and you can ask it any question you want, and it'll surface an answer based on the literature that's been published and peer-reviewed and qualified. So and Walters Kluwer just did another one. So all the literature is helping. So now doctors can do queries, but people can too. I guess the question I have about the healthcare system, Vinod, is if AI is so amazing, I don't know if anybody...
I'm projecting a little bit ahead of today.
But all the money we save, I don't know if anyone from the government's here. I know there are some people, but how much money is fraud and abuse in medicine? What percentage of it? It's a lot of money. It's billions and billions and billions of dollars. Why wouldn't we just train AI to fix the fraud and abuse?
No question about it.
Why wouldn't we start there to just soak up that money back and then invest in other things versus,
So Medicare Advantage, talk to any MA plan people here.
That's a no.
MA plans, when I talk to MA plans.
MA is Medicare Advantage, just.
Yeah, sorry.
It's okay.
Risk bearing, I talk to those plans, say, can we do primary care for you? Can we do mental health care for you? And the answer, we're not at risk of that. We parceled that off to somebody else. Can you help us risk score up? And most of the fraud is in risk scoring patients for diseases they might plausibly have, or you could document evidence for, almost all of it. So
is
the first thing CMS...
Is that ethical?
No, it's not, but that happens in 95% of MA patients or Medicare Advantage patients. It's like letting the fox in the hen house, because we are having the people who get paid for taking risk score how much risk there is in a patient. I know who conceived this at CMS. Let a plan score how much a patient should be paid once they take one. And so they spend all their time scoring it up. Can an AI score a patient? Absolutely. And CMS should have AI score a patient and have an avenue for appeal to human physicians. So if you disagree with the AI, you have some place to go. And then the Medicare Advantage plans will spend all their money on providing better care, lower cost, total cost of care.
So I want to try to bridge what you just said to a question that I really wanted to get to, and then we're going to let the audience ask some questions here. It strikes me that right now in the world of AI, there are a million startups, slap AI on it, get a seed round, okay? But it has already basically coalesced around the same sort of half dozen companies that have scale, leverage, touch points, and aggregation. Amazon, Apple, Google, Microsoft, and the newcomer, recently, 100, you just did the financing for OpenAI at $150 some odd billion.
Yeah, but none of the companies you mentioned are really doing AI in medicine.
Well, but with 20% of the U.S. GDP at play, my guess is they will be. They need to go to big needle-moving places.
Let me make the following.
Can we trust them to do everything we're just talking about?
Look, their goal is profit maximization. By and large, and I'm biased, I grew up in the tech industry, and we funded Google in 1996 and Amazon in around the same time. So I was I'm pretty close to all these companies, and I sort of happen to trust them more than most people in the press do. But I will say in the 40 years I've been doing innovation, and innovation only, technology-based innovation, I can't think of a single example in any space that was done by a large company. Almost every large innovation came from a startup. Whether it was Hertz couldn't do Uber, Hyatt and Hilton couldn't do Airbnb. Lockheed and Boeing couldn't do SpaceX and Rocket Lab. The car companies couldn't do what Tesla did. Not a single example in 40 years of large change driven by a big company. Even vaccines for COVID were done by startups.
Right.
So I'm not worried about the big companies. I think almost all innovation comes from startups, in my view.
Well, they'll probably.
And if
buy them.
somebody has an example, please come talk to me, because the only example I could find was in the early 70s when Bank of America put credit on your credit card,
Right.
plastic credit card. That was the biggest example I could find.
I want to stop us from asking questions and give a few minutes to all the doc community. We're just going to let you raise your hand because we don't have mic runners because of the two of
Right
you.
up here.
Oh, we do.
Yeah.
Wonderful.
Trish?
Will one of the innovations be that women can be mothers?
I'm sorry?
Will one of the innovations be that women can be mothers?
That women can be mothers.
That feels like a loaded question. I'm not sure I understand it.
No, I mean, the social support for being a mother is zero. In the new economy with all this wealth, will women be able to be mothers?
You know, so we are, by the way, doing an artificial womb too in our portfolio at the Children's Hospital at CHOP in Pennsylvania. But I would say humans get to do what they want to do in today's world. And women are not having kids. In Korea, when you need 2.1 children per woman, the birth rate is 0.6.
Yeah.
Why has more children?
I have 4 children, so. Yeah. So I do believe women and men enjoy children. I enjoy my kids a lot. I still, even though they're in their 30s, I prioritize them over almost anything else. And yesterday I was in Denver and I went home just to have dinner with the kids. And then I came here at night. And I'll be home by dinner time to hang out with the kids tonight, even though they're in their 30s and they're mostly doing their own things. So, but I do think women and men will have way more time to actually care for children. And I think that's a good thing. And they will want to do it, but they don't today because there's too many other pressures to make a living.
Let's let Norman ask
We have a
first.
question from Norman Winarski, and for those of you who don't know,
By the way, I covered that issue in my paper.
Norman was one of the co-inventors of Siri, is that right? Okay.
True. Yeah. Can you hear me?
Yeah.
Yeah. So, Vinod, I was also shocked by the great abilities of the current LLM models, ChatGPT, all of those. But there's one major flaw that has been and commonly known and understood, which is hallucination. And in particular, if you're asking questions relating to healthcare and to a patient, for example, hallucination could be incredibly serious, giving the wrong answer, the wrong diagnosis, maybe it's listening to a patient that says, I'm suicidal, or maybe it's listening to a patient that's saying, hey, you know, I'm giving away my dog, I'm selling my house, I'm just going to be nowhere. And it has to understand that. That's where humans have come into play.
Let me disagree. I think it's a platitude to say these systems hallucinate, hence we can't use them. Do they hallucinate some today? Will they hallucinate less tomorrow? Absolutely true. But the people who are using it today have many ways to avoid the dangers of hallucination by cross-checking and others. That is pretty common practice now in well-developed systems. So for the hallucination problem, I know one company using 19 different LLMs talking to each other and cross-checking each other. For example, to address hallucination, I can tell you about 4 different ways to avoid the inpatient being delivered hallucination or not being responsive to, I want to kill myself, or even indirectly expressing those thoughts. These systems are pretty damn good at solving those problems, but this is why the general models won't do that, because they have to develop a model for everything. Now, they will start post-training models just for medicine or just for sales or just for their own specific industry. But I do think those are all solvable problems, especially given the rate of progress the next couple of years and the techniques people have already developed. I would also say I'm a big believer we haven't seen, today almost all the big LLMs are based on transformer models, a particular type of mathematical approach. But there's half a dozen other approaches being tried. And we are trying multiple other approaches that don't use transformers to come up with other ways that solve these problems more efficiently. Instead of needing to use 19 LLMs, they have provably correct and explainable systems. Now, these are all in development, so I'm projecting a little bit out.
Missy Krasner, ex-Google, ex-Amazon.
Yeah, Vinod, it was great to see you. We're a huge fan of what you preach here. I met you when Neil, your son, was getting Curie lifted up early days when I was at Amazon. Yeah.
My son's doing primary care.
Great progress there. Love what you've done. So look, I'm here as one of the fellows just launched Penguin AI, which is LLMs for payer tech, and invested in it, helped get it off his feet. I'm a huge believer in this. I think there's a big debate in the industry right now there's not going to be any God models. No God models. What I mean by that is foundation models that are going to own healthcare. I think to your point, it's going to be a lot of, highly refined small language models that are task-based, that are very specific to the language norm, and this is totally your area. But more importantly, I think there's so much low-hanging fruit just in administrative stuff. Like, people can sit here and debate how scary it is to, replace a nurse or to have interns and have a, physician supervision. Reimbursement is the bigger issue. This is going to happen. The train has left the station. What I'm curious about is, and what I'm excited about is, maybe you can explain to the audience kind of what we're seeing with, sort of an agentic framework where you've got multiple agents. Can you imagine a world where you've got an agent that's doing prior auth and they deny the prior auth coming through, and another agent from another vendor that is doing appeals management? So you've got two agents that are essentially duking it out, may or may not be on the same LLM or multiple LLMs, right? That's an interesting world where as long as you have a human in the loop, why would anybody want to spend a ton of money on that, right?
So the progress in AI has gone LLMs, which is what we've all heard about, ChatGPT. The next step after that is what we call reasoner systems that can reason. And because you can reason, you can do 10 steps of planning, which LLMs can't do. So OpenAI released O1. Now it's separate than their LLM, which is GPT-4. Next comes agentic systems, which actually go do the work for you. And if I say to my AI, make sure I'm not late, it knows to check my calendar to know late for what. It knows to go look at Google Maps and say, it'll take this is the traffic conditions. And by the way, if you're calling an Uber, Uber takes 10 minutes to arrive, so you have to leave by a certain time. So that's doing work for me, doing the whole task like my EA does for me today. Though that's agentic. And you can do that with prior auth, you can do it with other kinds of planning. It's doing a sales call for you if you're a sales agent. Almost any function can be done. What comes after, and Anthropic just released their agentic framework last week, I think. OpenAI said they're releasing one soon. I'm sure Google will too. And it's pretty exciting. But what comes after agentic systems is very exciting to me, will be AI scientists, the best scientists. So any of your companies using five scientists or PhDs, whether it's in material science or in gene therapy, you'll have 5,000 of them working for you under those 5 scientists. And the rate of innovation will go through the roof. I suspect in the next 5 years, we'll start to see that. And so after agentic systems, will come scientists. And after scientists, I think Sam Altman has said this publicly, it'll be agents that actually do a whole organizational thing. So they behave like a multi-person organization. So that's a pretty exciting future.
Well, I just want to make sure the government's involved once AI agents form corporations and go public. I just want to make sure that we don't forget about government. That's all I have to say about that.
We have a question up here, up in the very
right in the front here.
There's a question in the back there too.
Yeah, I think we can do 2 as long as they're very concise because we're almost out of time. Yeah, we'll definitely get to you.
So it's obvious that intelligence is becoming free, and O1 is probably more intelligent than all of us here, maybe even together, already today. But Mark Andreessen said that there are two ways in AI. One is as Google went, and that is absolute monopoly. And other one is that it's going to become so free that basically all these companies making it won't make profit. Everyone will be able to have AI. What is your stance on that?
Why does anybody care? These are smart people making their own investment decisions. Nobody else should care. Eric Newcomer just wrote a good piece on this. Nobody should care if they're making the wrong decisions. If Sundar is wrong in saying it's too important an area not to invest in,
CEO of Google.
the CEO of Google, the risks of not investing are far greater than the risks of not investing. They live or die by that decision. And most of the companies, whether it's Microsoft or Google or OpenAI, they've made the same decision. They want to invest.
Okay, last question.
Short and sweet. Monica Plath, founder of Little Bird. I wanted to go back to earlier in the conversation where you kind of glanced over this intersection of care and safety. And I want to focus on innovation there. And also, everyone's training language models, but where is that data aggregation happening? And how important is the aggregation at the ground level from people or humanoids later, aggregating it, and also in early childhood, how are we taking these baselines or even identifying baselines that we can extrapolate the outcomes that everyone here is trying to address?
Yeah, so AI safety is a very complex topic. Of course, there's one that AI gets smart and kills us all. I think those kinds of risks are real, but very tiny. There's also a risk an asteroid hits our planet or another pandemic hits the planet that we can't stop. So humanity always deals with this. I worry about risk of China using AI against us, which they are in the current election, and will in the future as these systems get better. I just heard from a woman at the Weiss Institute, which is one of the more respectable labs at Harvard. She thinks there's our adversaries designing poisons which have idiopathic symptoms. That means a poison that might induce Parkinson's disease instead of it's scary. So there are real risks that we just have to manage. And AI is a little bit harder than most other technologies. We've had nuclear, we have had biotechnology, all have had risks, but they've always been visible when those technologies are used. AI will not be visible. So I've always said non-verifiability of AI makes it impossible to have international treaties unless you're willing to trust Putin, which I'm not. So it is a real danger. I think we should exercise real care. There are national agencies. So before OpenAI released their current model, they spent a lot of time with the national security apparatus saying, can you test it? Yeah. Now, formalizing that will happen, but I also think we will develop AI systems. For example, we have a company called Symbolica that's using category theory, which is an obscure math concept, not transformers, to explain all the AI and maybe explain what LLMs are doing.
That would be great.
Thank you.
That would be just great to understand how this stuff is happening so scientists...
Well, I think real attention is being paid. Yes. That means we'll solve the problem.
Excellent. Well, we could go for hours and hours, and I wish we had that time, but thank you for giving us the time you have.
Thank you.
Thank you. Thank you.